Oh, it's really nice to be back in studio recording again. These are always great times. It will complete the year. This is our 12th episode.
Wow.
It's pretty
that's
amazing.
Incredible.
Yeah.
Thanks for bringing that up. I didn't even realize that.
So we've had some wonderful experts on. This month is no different. We've got a great expert. Marianne, why don't you introduce our guest?
Oh, I'm so honored for this 12-month milestone. This is so exciting to have Dr. Kevin Trentino, all the way from Australia. Dr. Trentino is a senior researcher with the medical school at the University of Western Australia, an executive member of the Western Australia Patient Blood Management Group, and a member of the WHO, the World Health Organization, Expert Working Group for Implementation of Patient Blood Management. Dr. Kevin Trentino's specialty and passion is healthcare data, where he has 20 years experience in data analysis, biostatistics, epidemiology, prediction models, and medical research. Wow. So, Kevin, you're among the 48 expert authors of the newly published and highly sought after Bloodworks and Owner's Guide. So, congrats on that too. Excellent book. Love it.
Thank you. And thanks very much for having me on the show. I've watched the other podcasts. I love them. I didn't realize I was the 12th. So that's fantastic.
Very special. Thank you. Yeah, that is fantastic.
Right off the bat, I'm going to ask you, Dr. Trentino, why should the public care or be interested in how their healthcare organizations use their data that they gather?
Yeah, that's an excellent question, obviously, and it's one that obviously very passionate about. I mean, if we put it in a nutshell, healthcare data is really at the heart of research and all the practice improvements that we see in hospital. You may have heard the saying, it's often attributed to Lord Kelvin, if you can't measure it, you can't improve it. So healthcare data plays such an important role. Now, when we're talking about healthcare data in this podcast, we're not referring to, say, the data that those large tech companies are collecting from our devices, which they're using perhaps to target advertising or sell on to third parties. We're talking about the sort of data that hospitals and healthcare organizations collect as part of our treatment. So when we go to hospital as an inpatient or outpatient, they're required to collect that data, at least a minimum amount of that data. And it has to comply with strict privacy laws, and they're obviously governed by ethics and community expectations on how to use it. So that's the sort of data that I'm referring to when we're talking about data. Why is that data so important? We need it. I mean, how else do we make decisions without it? A key problem, though, is at least in one survey, we find that the majority of healthcare professionals would choose to go over gut feel rather than use data. And that's an issue. I don't think anyone wants to be treated by healthcare professionals that would use gut feel over data. Unfortunately, that is something that happens quite commonly across various sectors. It certainly has happened across health for a long time. I mean, we could go all the way back to the 1850s with John Snow and the cholera epidemic. John Snow used data to identify what the source of the problem was, the contaminated water, even which pump it was coming from. But then we've got what was the conventional wisdom at the time, or that gut feeling at the time, if you like. That was miasma theory, and that cholera was transmitted through foul smells. Now, I'd like to say that since then, things have changed and that we're using data over gut feel more, but that's not always the case. I guess this is the thing, though. If I was a patient, or for anyone who's the member of the public, what really is important for us, it's making sure that our healthcare organizations and our healthcare providers are using data. So I guess it's about asking questions like, how is the data used? Are you, or is the healthcare organization using data to compare how their practice varies from what is evidence-based guidelines? In addition to that, is there a large difference between what the healthcare provider's practice is and what the practice of other organizations are? Do they vary widely? We really want members of the public to be informed. An informed patient is someone who's very powerful. In fact, it's in one of the chapters in the book where we make the point that an informed patient is someone who can actually change practice. Change begins with practice, I think, is a comment that comes up. So we really do want informed patients. We want patients who are able to understand data, understand how it's being used, understand how their healthcare organizations and healthcare providers are using those.
You bring up a good point about the Bloodworks book. You were one of the 48 renowned authors, as Marianne brought up. And my understanding is that each of you donated your time and your expertise to the creation of the book. It's not for profit for you. You donated your time and energy towards this creation of this book. What motivated you to want to participate in such a huge undertaking?
Yeah, it certainly was an exciting thing to even be invited. I've been involved in patient blood management research for over the past 10 years. And so it's 48 authors, but they're really 48 friends. And to be able to work with these experts was something that was really fun for me, and I actually learned obviously a lot from the experience. You meet so many great people in this field, as you are aware as well. I guess the main driver for me is so much is published in the medical literature on patient blood management, or even the term we're using frequently as well with blood health. So much is published in the medical literature about that, but very little of that actually goes to the public. It's not accessible, or it's not in a format that's digestible for members of the public. Why is that so important? Well, blood health obviously is really important to good health. I mean, we often talk about the health of other important organs in the body. We talk about heart health, we talk about kidney health, and members of the public are interested in things like what their levels of cholesterol are, or what their blood pressure is, and they're able to communicate and understand what those numbers mean. But when we ask people, what's their hemoglobin level, or what their iron stores look like, do they know what their ferritin is? Very few are able to answer questions like that. And so that's why participating in this book was so important for me. I think I'd really encourage everyone to have a look at the book if they haven't had a chance to do so. By looking after our own blood, which is something the book obviously encourages us to do, naturally we're going to feel a lot better in ourselves. We're going to feel good, which we all want to. But we also will minimize the chances of things like receiving a transfusion. And that comes out very strongly in the book. I think one of the comments in the book is that blood transfusion is potentially associated with the greatest hazards out of any medical intervention. So a very important reason for us to look after our blood health. Also, I guess we've touched on this before, it really comes down to the issue of patient empowerment. An informed patient is someone who's more likely to feel confident. They're more likely to expect that their healthcare provider will engage them in the decision-making process. They'll be more able to contribute to their own decisions as to what treatments or decisions they would like to make.
Kevin, I love that you said about, it's like working with your friends when you're working on that book, because I say that all the time. We're like a big family in patient blood management, and I think a lot of people get just so much joy and put so much love and dedication into patient blood management. And I know every time I see a Kevin Trentino paper come out, like either somebody's already told me or I am all over it, like just excellent work. And it shows. It really does show that the importance and the dedication that everyone puts into this work and the data. So thank you for that. And I think it really shows in that book too. Like the book is just such a joy to read. But it's also based on folks like yourself and, all this research that is good research that people have put into it. So thank you for that. Sorry to get off track a little bit.
No, I mean, I'm glad you raised it because it's one of those things, where you get a lot more out of it than you actually put into it. So, I mean, I think I learned a lot from that book as well, and working with those authors who have been involved in the field for decades.
Yeah, and patient blood management is really about interdisciplinary because we all have different jobs and we're all coming from different countries and different fields. And really, at the end of the day, it's better for the patient because we're getting so many perspectives into it. And I really, truly think it's better for the patient when we work that way.
Absolutely.
So, excellent. Speaking of Australia, how important was the data in implementing patient blood management in Western Australia?
Very important. In fact, vital. And maybe I'll just come back and give a bit of context for the viewers as well. Is that there is research which suggests that on average it takes 17 years to get evidence into clinical practice. Now, I'm sure that I could speak for every potential patient in the world here. I don't really want to wait 17 years, or I don't want to be going to a hospital and be treated according to guidelines that were from 17 years ago. That's not great. That's not keeping up with the latest evidence, and I don't think that's what the community would expect when they are being treated. So that's a real challenge in the sense that it's hard to change practice in any industry, in any sector. It's certainly very hard in healthcare. And I think this is where data has one of its strengths. And an excellent example of this is the Western Australian Patient Blood Management Program. Data played a key role in the whole process, right from pre-implementation, even going past to post-implementation. We even had one of our surgeons who commented the use and the provision of data, that feedback of data, was really a strong motivator for them to want to change practice. So we even had that feedback, which was excellent. We did a program evaluation 6 years into the Western Australian Patient Blood Management Program, and we found that practice did change significantly. So we saw significant reductions in elective surgery patients that were being admitted anemic, which is very important. We saw a reduction in the pre-transfusion hemoglobin thresholds. And Western Australia already started off with a relatively restrictive red cell transfusion practice. So to see that reduce significantly further. We also saw reductions in use of red blood cells, plasma, and platelets per patient admission. And so to see those things change, say, within the first few years of the program and not have to wait 17 years to do that was absolutely fantastic and an important finding. I mean, data isn't the only way to change practice, but it certainly is a key component of it. It assists all those hardworking clinicians that are trying their best to keep up with evidence-based guidelines, to keep up with the latest literature and trying to apply that or implement it in clinical practice.
Sarah, we could probably pin this infographic to the podcast later, but we were just looking at that infographic from Western Australia, and boy, implementation of your patient blood management, what was it, about 600,000 patients?
That's right. There were 600,000 patients. At the time, it was the largest study conducted into patient blood management. It was 600,000 patients over a 6-year period, because we were looking at what we called a statewide program. So it was across multiple hospitals. It wasn't just restricted, say, to surgical patients. It was across all surgical and medical patients. So it was really a large program, and as you can see from the result, a large study as well to evaluate.
Yeah, and you demonstrated improved patient outcomes, mortality decrease of 28%, infection decrease of 21%. AMI stroke decreased 31%, length of stay. I could see how, with these numbers, anybody would want to implement a patient blood management program.
Definitely.
So much better for the patients.
Absolutely. So improved patient care is really the main driver for patient blood management. It's the reason why everyone works so hard to implement it. And also, it's important to mention that the cost savings from it, the cost savings were significant. And while patient care comes before cost savings, having those cost savings allows us to reallocate those resources back into patient care. So it is also good for the patient having those huge cost savings.
Exactly.
What is the relevance of data analytics to a healthcare system?
That's an excellent question. I mean, data analytics is such an important part of healthcare. I think I'm quoting here from a book by Nate Silver, which is The Signal and the Noise, which he says, data don't speak for themselves. We need to imbue them with meaning. So it's not just enough collecting data. It's really about what we do with that data. As I mentioned before, obviously data is going to be a key role in driving change. We can't afford to be the average and wait 17 years to keep up with evidence-based guidelines. We really want to be a lot faster at applying what we find in the high level research. For me, an organization that actually uses data is an organization that's going to stay at the forefront of healthcare. That's so important. I don't think any patient wants to be treated in a hospital that's not using data. I think what's very important for members of the public is to be able to ask questions of their healthcare providers as well. Is how is data being used? How is my data being used? How is the hospital using the data that it's collecting on the patients? Is my data being used to see if my recommended treatment differs significantly from how others are being treated, say in the same healthcare organization, but also in other parts of the country I'm in or other parts of the world? If there's a difference between the treatment I'm receiving and the treatment others are receiving, why is that? And data is able to answer all of those questions. It really does come down to that. If we're not going to use data, what's the alternative? Is it gut feel? Is it conventional wisdom? And if evidence-based guidelines are changing every sort of 3 to 5 years, then conventional wisdom or gut feel needs to also be updated. And so data-driven decisions like that are very important in healthcare. They play such an important role.
I have in my hand, hot off the press, article that you are a co-author in. It's called Data and Metrics for Patient Blood Management, a Narrative Review and Practical Guide. We will make sure to link it into our podcast episode. But it really outlined some key data metrics and information that hospital organizations need to consider when they are looking at their patient blood management. Could you tell us a little bit about your article?
Absolutely. Thanks very much for referring to the article. We felt that this was a really important article to write. The reason why we felt it was so important to write is because not a lot has been published or is available around what data is important to collect for a patient blood management program. We could see that other healthcare providers and organizations around the world who are looking to implement patient blood management or accelerate their program were keen to use data and were perhaps struggling to know where to start or how to use it. That was the main motivator behind doing this, was to be able to help our colleagues right around the world to have some sort of tool to be able to know what data to collect and how to report it. Very important for all the reasons we stated. What we actually did with that study was we looked through all of the medical literature and we looked at all the examples published of where healthcare organizations had actually implemented a patient blood management program.
Mm-hmm.
And then we started to look at, well, what data were those programs collecting and how were they reporting it? As in, what were the metrics they were using as measures of success? So that's really what that research does. It reviews all of the data items that have been collected in the literature and what has been reported. That helped us to form quite a comprehensive list. So we identified 65 data elements that we targeted for healthcare organizations to collect for patient blood management. Also, I think it was 36 outcome metrics to report, so you can track the success of your program. And I think some of the good news or the encouraging news that came out of it was those 65 data elements that are already captured by hospitals as part of their routine data collection. So we're not talking about collecting any extra data or going back to the patients for any extra information. It's data that's already collected. And so we indicate where you may be able to find those data elements and how you can use it. The other really encouraging thing I think from the study is the point that it brings out, which is sometimes we get overwhelmed with data. There's just too much. We're not sure how to use it. But even just with very, very little data, just with very basic collection, there's still a lot that we can do.
I felt that this article was really a key piece to any organization who is looking to either implement patient blood management, to know what type of data metrics to go after, and also anyone, like you said, trying to improve or increase their efforts in patient blood management. So it's going to be beneficial for all healthcare organizations.
Absolutely. As brought up before, there's that famous saying, if you can't measure it, you can't improve it. We want to measure it, but then the question asks,
Right.
what am I measuring?
Mm-hmm.
Right.
And what do I need to collect to be able to measure that?
Yes.
So, speaking of collecting, is there a specific tool that you use, or is there a specific program, or can organizations create their own tool to collect all this data and metrics?
We absolutely would encourage organizations to collect their own metrics. We didn't use a specific tool. In Western Australia, at least, we built it in-house. The article brings out all of that data is already routinely captured by hospitals. So the data's there. It's just a matter of extracting it and reporting on it. Healthcare organizations are already quite sophisticated at using data for producing monthly reports, whether those reports would be up to the C-suite or data used for research. There already is a certain amount of that happening in healthcare organizations. So for those looking to build their own patient blood management data systems, it's about finding that department, finding where that data is collected and finding ones that are already doing that, leveraging off that. So you're not having to build anything from scratch. There's nothing new to do. You don't necessarily have to involve third parties if you're not in a position to do so. You can do those with your in-house resources. That's something we would encourage others to try. Absolutely. The benefits is it gives them flexibility to tailor the data around their specific patient blood management program.
So, Dr. Trentino, can you tell me what is the future direction in data analytics? Is there anything new or any changes that we're going to see coming?
Excellent question. Excellent question. I think when we look into the future, there's a lot of potentially exciting things. It's hard to differentiate what is hype from what will bring actual benefit, but I suppose that applies to any future endeavor. Certainly, I think one of the areas which foundation for patient blood management into the future, and this is already happening, is benchmarking is a key point. Why is benchmarking so important? Benchmarking is important because once we've been able to establish a baseline of what our own healthcare organization is doing, how it's tracking with our patient blood management initiatives, we've got our own metrics for success set up and we can see how we're going. Naturally, the next question is, well, how do I differ to others. And that's where benchmarking is so important. How do I differ with others that are in the same country, healthcare system, or others internationally? There already is some good work being done in that area. I know in Australia and New Zealand, we started with some benchmarking across hospitals. That's Dr. Bisbay and the group from Spain certainly are doing some excellent work with benchmarking. And that benchmarking also provides an opportunity for patient blood management experts to get together, to network, to see how they differ, and to learn from those that are the best, or that in a certain area are doing really well. So it's a fantastic opportunity to drive future benefits. Benchmarking clearly is something that's going to be important going into the future. The other area, which is really, I guess, really exciting, but harder to predict, for want of a better word, harder to predict how well it will be applied in reality, is the area with big data, machine learning, and AI. I think that's a hot topic for everyone, and it's clearly goes across every sector. Certainly a lot more data is captured than before. So when we're talking about big data, we're not just talking about lots of data. We talk about the 3 V's, they call it. So we've got the volume, which is pretty self-explanatory. We've got the velocity of data and the variety of data. So when we say velocity, we're talking about collecting data, say, from physiological sensors, where we have multiple measures per second, maybe even hundreds of measures per second per patient. So we're talking about very big amounts of data. And then variety, not just data as in the traditional sense, but also data from, say, images extracted from imaging and things like that.
Wow.
How we make best use of that data for building prediction algorithms and turning that into machine learning and AI is very interesting. There's certainly been some early research done in the area, but there's a lot longer way to go with that. You can see how prediction would make such great applications in patient blood management if we're able to predict or even detect a patient that is bleeding post-surgery before we would normally notice those things. That's obviously got fantastic applications for patient blood management, even for patient care, clearly. We're able to predict, we know quite easily whether an elective surgery patient is likely to receive a transfusion or not. There's certainly been some excellent studies using statistical and machine learning models to predict that, and that can be predicted with very good accuracy. So then it's about, well, how do we implement strategies then to address that? How can we change those risk factors which are modifiable? How can we convert that into improved patient care? Definitely an area to look out for, but there's a lot more to play out in this space for sure.
So what was that again? Volume, veracity, and variety. Did I get that right?
Yeah, volume, velocity,
Mm-hmm.
and variety. Yeah, the three V's of big data. And it does change everything. It changes the way we collect data. You can't, when you've got that volume, velocity, and variety of data, you can't store it in typical ways. And certainly this would have been impossible years ago, but with advancements we've got not only in computer hardware, which makes it more affordable to store massive amounts of data, but also advances in the way we analyze these data. It's making things possible that weren't possible, say, only a few years ago. So it is a fast-moving and evolving field.
I feel like my mind is taking a real deep dive into data. The future of data. It's hard for me to visualize. But what is the key points that you would like people to take away from our discussion today? If they take anything away, what would you like people to walk away with?
Very good question. For me, I guess it all comes down to the point. There's no point in collecting data if we don't then do anything of value with it. So that's probably the stage a lot of us are at, running around collecting as much data as we can, but then probably not putting a lot of effort into actually using it or applying it for patient benefit. So for me, it's seeing maximum use of what is already collected. I think one of the most important things which has come out in this podcast is having an informed patient. Patients,
Yes.
we can't underestimate how important the public are in driving change. Change begins with patients. So having patients take more of an interest in their own care, having patients take more of an interest in their own healthcare data, and having patients take an interest in how their healthcare organizations or healthcare providers use that data, and asking important questions like, how does the practice I'm receiving differ from what evidence-based guidelines are? And how does whatever care I'm receiving, how does that differ from the care that others are receiving? If our healthcare organizations and providers can answer that, then we've got a good sense that they're using that data for patient care. And if not, that's where we want to get to. We want, as the public, to be able to encourage that use of data so that it actually translates into practice.
And thank you so much, you and your team, for putting together these metrics so that you can help us, help ourselves, help the patients. Help us get our mind organized on what we should be spending our time on collecting and how to use it. That's incredible.
I'm definitely going to be more in tune to data when I hear it in my healthcare organization and what I can do with that, how I can implement change and forward movement. So thank you so much for being with us today. And thank you for helping us round out our year.
Yes,
I was just going to say thank you so much and congratulations. 12 months of podcasts. Yeah. That's an excellent achievement. And it's been so nice to be on the program. And thank you so much for inviting me.